If you have classic signs of B12 deficiency like fatigue or low energy or memory issues, or you may have difficulty concentrating, or if you have neuropathy and then your doctor checks your B12 levels and it comes back normal, well, you may still have a B12 deficiency despite that normal result. You're just not utilizing the right test. Your B12 test can often look fine even when your cells are running dangerously low on what they need to function. And unless you look at the right markers and you know how to interpret them, you can miss this key deficiency that quietly affects your brain and your nerves and your energy. So in this video, I want to go over how to accurately measure your B12 status and what tests you need to order. But keep in mind, it's not enough just to run a battery of tests. We have to understand how to put those results together to see if you truly have a B12 deficiency. And it's incredibly important to get this right, because if you truly are deficient in B12, you have to identify it early before permanent damage sets in. And as always, even though I'm a physician, I'm not your physician. So please talk to your doctor before you make any changes to your health regimen, as this video is educational only and not medical advice. All right, so the key lab tests that we're going to talk about are methylmalonic acid and homocysteine and holotranscobalamin and MCV. And I'm going to show you how and when to utilize each one of these tests, and more importantly, how to connect those dots when your symptoms just don't match your lab report. Because especially when it comes to B12, the real truth is not on the surface, but it's usually hidden in how your cells are using it. And a lot of the times, instead of looking at your B12 levels directly, what we have to do is to measure how your body acts when it doesn't have enough. Okay, so with my own patients in my longevity clinic, if I have a strong suspicion for B12 deficiency, I never order B12 by itself, and I always pair it with a test called MMA, or another name for that is methylmalonic acid. And here's why. Inside your cells, B12 runs a reaction that turns a molecule called methylmalonyl-CoA into succinyl-CoA, which is an incredibly important form that your mitochondria needs to generate energy. So if you don't have enough B12, that process slows down and methylmalonic acid builds up in your blood and in your urine. So high methylmalonic acid levels or high MMA levels is one of the more sensitive and early signs of a true deficiency. Even when your total B12 levels look fine, a rising MMA means that your cells are struggling. So a good analogy for this is car exhaust. If your engine is not burning gasoline efficiently, you'll see more smoke, and MMA is that smoke. It's just an early signal that something's not going right on the inside. But one important caveat here, MMA levels can also be high because of other reasons, not just low B12. MMA can go up if you have kidney disease, and MMA can also fluctuate depending on your age and your other biomarkers that I'm going to talk about a little later. So we have to account for all of those things when interpreting your MMA levels, but your doctor should be able to guide you on that. Okay, the next test that I want to talk about is called homocysteine, and homocysteine is a metabolic marker that rises when you don't have enough vitamin B12 or folate for basic cellular metabolism. And here's how it works. Your body uses B12 along with folate, which is vitamin B9, and B6 to recycle homocysteine into methionine. This is a very important process because methionine is an amino acid that your cells need to make proteins and to repair damaged DNA. So this is a similar concept to what we see with the buildup of methylmalonic acid or MMA that we just talked about. If your cells do not have enough B12, or if they can't utilize B12 properly, homocysteine starts building up in your body. Now, this buildup of homocysteine is not just a secondary marker of B12 deficiency. High levels of homocysteine is likely damaging to your health just by itself. In fact, high homocysteine levels are considered to be an independent risk factor for cardiovascular disease and dementia. But here's something you don't want to miss about homocysteine. Homocysteine can help us build a case that there may be a B12 deficiency, but by itself, without other tests, it's not specific enough to definitively assess your B12 status, because it's not just B12 that affects it. Other B vitamins like vitamin B9, which is folate, and vitamin B6, which is pyridoxine, can affect homocysteine levels as well. And on top of that, homocysteine levels also fluctuate depending on your kidney function and your age. And also, there are some medications that can affect those levels as well. And another important caveat to consider is some people have a variation in their MTHFR gene, which affects affects the metabolism of homocysteine. So all of those different variables need to be accounted for when you're putting this puzzle together. And I actually go a little deeper into homocysteine in one of my other videos. So I'm gonna post a link to that in the description below. Now, the two tests so far, MMA and homocysteine, they're not direct markers of vitamin B12, but they're more of indirect signals of a B12 deficiency, even if your B12 levels appear to be normal. So why is there such a disconnect in the first place? Well, this is why. The standard B12 test measures total B12 in your bloodstream. And that sounds simple, but most of that number isn't actually usable B12. About 80% of it is bound to a carrier called haptocorin, which is functionally inactive. So that means only a small fraction of circulating B12 can be used by your cells. And that is the B12 that is bound to a carrier called transcobalamin 2, or another name for that is holotranscobalamin. And only this form can be absorbed by your cells. So that brings us to the next test that can help us. You can actually measure the levels of usable and active B12 by checking the levels of holotranscobalamin. And this is actually one of the most accurate tests for B12. And a low holotranscobalamin is the earliest sign of vitamin B12 deficiency. Now, not every lab runs this test routinely, and the price for this varies quite a bit. But if you can get it, it's an incredibly helpful test. Okay, another test that we usually end up ordering if we suspect low vitamin B12, even if you have normal B12 levels, is autoantibodies to intrinsic factor and anti-parietal cell antibodies. And these are tests to evaluate if someone has an autoimmune condition called pernicious anemia, where your own immune system attacks certain parts of your stomach lining called the parietal cells, which can then lead to malabsorption of B12. Now, there's more tests we gotta go through if we suspect pernicious anemia, but that's a whole other topic for another day. And one last lab test that I want to mention. It's not the best test or the most accurate test for B12 deficiency, but it's probably the easiest to get, and it's the one that your PCP checks with your yearly blood test anyway. And that test is called MCV, which stands for mean corpuscular volume. Now, your MCV shows up as part of your CBC, or complete blood count. And MCV is just a measure of the average size of your red blood cells. But the reason it can point to a B12 problem is because when your body is low on B12, it struggles to make DNA for new red blood cells. And that results in oversized cells, which will then be reflected in an increased MCV. That is why low B12 can lead to a very specific type of anemia called macrocytic anemia, meaning large cell anemia. Now, one important point here is an elevated MCV can only raise our suspicion for B12 deficiency, and we still need all those other tests to confirm if that's what's actually going on. And that's because there's many other things that can make your MCV to go up. It could be a folate deficiency, or chronic alcohol use, or liver disease. It could be a low thyroid function. Also, on the flip side, you could have a low B12 but a completely normal MCV. But it's a cheap test, and most people have it checked with their yearly labs anyway. So the bottom line here is, if you have signs and symptoms of low B12, and I made a video about this earlier that you can check out over here, and normal B12 does not rule out a deficiency, because that test is a blunt tool. It cannot tell you how much of the active B12 you have, or whether your cells are actually using it. And in medicine, it's not about chasing normal or perfect numbers. It's about understanding what those numbers mean in the context of your own biology. I hope this was helpful. Stay healthy, and I'll see you in the next one.